General's office continues piecing together two deadly police shootings in Hartford. In both of these cases, officers shot and killed people who were having a mental health crisis. But how are police officers and state troopers in our state trained to deal with someone in crisis? The I-Team asked this question, and your chief investigative reporter, Sam Smink, got some answers. Sam?
Well, Kara, in Connecticut, as recruits, all officers and troopers have required training for interactions with people dealing with mental illness or disability. Altogether, that basic training comes out to about 29 hours.
The Police Officer Standards and Training Council is the state board responsible for coming up with training standards in the state. Executive Director Thomas Wydra says first responders are getting more mental health-related calls than in years past. Calls like the ones that resulted in the deaths of Stephen Jones and Everard Walker. Both were in the middle of mental health crises. Both men were armed. We've learned that in Connecticut, recruits are given at least 29 hours of training in mental health first aid, de-escalation, and use of force. Wydra says there's a big difference between a police officer dealing with someone in a mental health crisis who's armed and someone who is not.
Somebody who is not armed, an officer does not need to consider in real time deploying a weapon, right. As opposed to somebody who may be holding an edge weapon or holding a firearm. You know, the officer has to then factor in other conditions. Their own safety, the safety of people around them.
Is 29 hours enough training? Wydra answers that question at 6. We also asked if the Training Council will require more training after these most recent shootings. Your chief investigative reporter, Sam Smink, Channel 3 Eyewitness News.